the anterior, here is the posterior of the vertebrae. This is a cervical vertebrae because it has a pivot spinous process. Look at here. Now let's review the external feature of the spinal cord. Anteriorly you have the median ventral fissure. Here you have the anterolateral sulcus. Anterolateral sulcus. Posteriorly we have median dorsal sulcus, posterolateral sulcus, and right here dorsal or posterior intermediate, right posterior intermediate. Look at this one, posterior intermediate sulcus. Now, as you see here, the gray matter located centrally, white matter located peripherally. This is reversed in brain, in encephalon. Now, in the gray matter, we have following features. We have anterior horn, we have posterior horn, we have lateral horn. We have lateral horn only between T1, L2, L3 segments and S2, S4 segments. You do not have lateral horn between C1, T1 segments, L3, L5 segments, L5, S2 segments, S4, coccygeal 1 segments, okay? And look at here, this is the gray commissure. Look at gray commissure. Commissure means junction. Junction. It's not crossing, but the junction. Kavşak. You see, this is the left half is connected to the right half of the gray matter. So this is called gray commissure. In the center of the gray commissure, there's the central canal.
It doesn't go through the entire...
It doesn't go run through the entire spinal cord. It is present only upper part of the spinal cord. Now we have the anterior gray commissure, posterior gray commissure in relation to the central canal. Now let's look at the white matter. Inside the white matter, you have the ascending and descending, both myelinated and unmyelinated axons. In the gray matter, you have the bodies of the neurons and the dendrites of the neurons. White matter is divided into 3 funiculi. We have 3 pairs of funiculi. Look at the white matter between the median dorsal sulcus and posterior dorsolateral sulcus is the posterior funiculus. You have 2 posterior funiculi, right? Right and left. White, and this is also together called dorsal column pathway. Dorsal column pathway.
In the brainstem,
It's only purely sensory.
in the brainstem, you mentioned a dorsal column medial meniscus pathway.
That's right, because if you go up, then this dorsal column pathway continues as a medial lemniscal pathway. We will talk about it during the ascending pathways. Okay, now the white matter between the posterolateral and anterolateral sulcus is called, look at right here. This is called lateral funiculus. Lateral funiculus. The white matter between the anterolateral sulcus and anterior median fissure is the anterior funiculus. Anterior funiculus. Look at here. The dorsal intermediate sulcus divides posterior funiculus into medially located cranial fasciculus and laterally located cuneate fasciculus. Cuneate fasciculus. Now let's look at the coverings of the spinal cord. Remember, I told you that you have dura mater from outside to inside. This is the dura mater. Just right here is the arachnoidal mater, and then this is the pia mater. These are the tendiculate ligaments. You see, these are tendiculate ligaments. Tendiculate ligaments. Can you see tendiculate ligaments here? These are the tendiculate ligaments. Look at this is tendiculate ligament, tendiculate ligament. Right, tendiculate ligaments, these are right here. Made of pia mater. Pia mater. And the tendiculate ligaments are 20 pairs, 22 pairs, and they prevent side-to-side movement of the spinal cord in the vertebral canal. And then, remember I told you that dura mater has an external periosteal layer. Well, most of the anatomy textbooks call this as simple periosteum, covering inside the vertebral canal. But for me and to some others, this is the external periosteal layer of the dura. And this is the internal meningeal layer of the dura. Between two, you have intradural space. But if you consider dura mater, this one, the inner meningeal layer, if you call the dura mater, then this becomes the epidural space. But you can call this extradural space, peridural space, or the... and you see here, these are what? These are what? Remember, these are the venous, internal vertebral venous plexus. These are, right? Look at, these are the internal vertebral venous plexus. You have, this is the posterior internal vertebral venous plexus. Here is the anterior internal venous plexus. You see that? You can see both. Posterior, this is anterior internal vertebral venous plexus. Communicate inferiorly with the, or caudally with the prostatic venous plexus, superiorly with the dural sinuses. Basically, the basilar and occipital sinuses. Posteriorly with the occipital sinuses, anteriorly with the basilar sinus. Okay, so the space between the dura and arachnoid is called subdural space. And space between, this is the pia. As you see, pia covers contours of the spinal cord. Its grooves, its fissure, all covered by pia. And again, between the arachnoid and pia, you have the subarachnoid space. Subarachnoid space. Let's come back and talk about the external periosteal and internal meningeal layers of the dura. Do you have this around the brain? Yes, you do have. You do have. And these two layers are attached at most sides. But at certain sides, outer periosteal and inner meningeal layers of the dura is detached, forming the dural sinuses. Dural venous sinuses. Look at here. Here you have the dural venous sinuses. Right here, this continues up like this. This is the superior sagittal sinus. This is the transverse sinus. This is the sigmoid sinus. Look at sigmoid sinus. Sigmoid sinus. This is the superior superficial petrosal sinus. This is the deep petrosal sinus. We will talk about that later on. Don't worry about it. And what else we can talk about? Okay, here look at this one. You can see the rootlets of the spinal nerve. This is the anterior rootlets. These are the posterior rootlets. And right here, look at this is the. Can you see here? Right here, this is the ventral root. This is the dorsal root. And right here you have the spinal ganglion. Spinal ganglion, dorsal root, ventral root, they are all covered by both dura and arachnoid. Okay, both dura and arachnoid. And right here you have what? Cell body of the sensory nerve fibers in the spinal nerve. Where are the motor nerve fibers? Where are the cell bodies of the motor nerve fibers in the spinal nerve? In the anterior horn and the lateral horn. But you don't have the lateral horn, right?
Yes.
Throughout the spinal cord segment, you know where you don't have. Right here, look at, this is the trunk of the spinal nerve, right here. Trunk of the spinal nerve. When posterior and ventral roots unite, they form the trunk of the spinal nerve. Trunk of the spinal nerve leaves the intervertebral foramen. And then spinal nerve splits into a small dorsal ramus and thick or the large ventral ramus. You know where ventral rami of the spinal nerves innervate, right? Except the head and except the skin of back and deep musculature of the back, entire skin and muscles on the body trunk are innervated by the ventral rami of the spinal nerves, right? Okay, how about this one? This is called paravertebral ganglia. Paravertebral ganglia. This is the rami communicantes. Rami communicantes. Rami is plural. Ramus is singular. We have white ramus and the gray ramus. White ramus is formed by the preganglionic sympathetics, which are myelinated. That's why they look like white, and that's why it's called white ramus, communicantus. And the gray ones are postganglionic. Since they are not myelinated, they look gray. Okay, they look gray. We will cover that. And this is what? Vertebral artery, right? Running through the transverse foramen. Running through the transverse foramen. Good. We can put this here. You see here we have the same type of, look at here, this is my spinal cord, or her spinal cord. Here is the anterior, here is the posterior, okay? So here is the dorsal root, ventral root, dorsal root ganglion, and here is the trunk of the spinal nerve. And here you don't have the ventral ramus and posterior ramus is not really shown here. And these are the rootlets, and we have more here. Okay, now let me pick up a brain stem so I can show you the cranial nerves. How about this one? This looks good. Yeah, this looks good one. Look at here. You don't see the olfactory nerve. I will show you olfactory nerve later on, but you can see the optic nerve. This is the optic nerve. Optic nerve. This is the, look at here, right here, this is the oculomotor nerve. Oculomotor nerve. On the back, on the posterior surface, you have the trochlear nerve. Trochlear nerve. And here, you have the fifth cranial nerve, trigeminal nerve. Its sensory root, its motor root. And this is the abducens nerve. This abducts the eyeball, laterally rotates the eyeball. This innervates the lateral rectus muscle. And then right here, I can see the facial nerve right here. Just lateral to the facial nerve, there is another little nerve there that's called intermediate nerve. That is part of the facial nerve. Part of the facial nerve. In the facial nerve, there are 4 types of nerve fibers. 4 types of nerve fibers, which are SVE. SVE actually make up the facial nerve. The other 3 fibers, which are SVA for taste, SVA for taste, GVE, parasympathetics, and GSA, GSA. Facial nerve receives GSA information from the auricle and external auditory meatus. So these 3 types of nerve fibers, again, the SVA for taste, because facial nerve receives taste sensation from the anterior 2/3 of the tongue. In the facial nerve, we have parasympathetic nerve fibers, which are GVE. And parasympathetic nerve fibers inside the facial nerve innervates most of the salivatory glands, innervates the submandibular gland, innervates the sublingual glands, innervates the palatine glands, innervates the lacrimal glands, So GVE fibers, also facial nerve receives GSA information, touch, like touch, pressure, vibration, cold, proprioception from the auricula pinna and from the external auditory canal. So these 3 fibers make up the intermediate nerve, okay? But the SVE fibers make up this larger one, the facial nerve. So you understand what the facial nerve and the intermediate nerve are. And then we have the vestibulocochlear nerve. This is the vestibulocochlear nerve. Vestibulocochlear nerve. Then you have the glossopharyngeal nerve right here, 9. Down here you have the vagus. They have not really shown the accessory nerve here. But here you have the hypoglossal nerve. This is the hypoglossal nerve. Let me get another brain stem so I can show you cranial nerves from another aspect. Not, okay. This one and this one, probably they are together. They are made to be together. Well, look at this one. This looks like that. Okay. Again, here is the optic nerve. Down here is the oculomotor nerve. Oculomotor nerve has GSE fibers, GSE, which innervates the extraocular muscles, including medial rectus muscle, superior rectus muscle, inferior rectus muscle, inferior oblique muscle, and muscle that elevates or lifts up the upper eyelid. It's called levator palpebrae superior muscle.
Do we have to know all of this?
Yes, of course. Of course, you will know. Well, don't worry about this very much because when we come to eye
Okay.
and the visual pathways, we're gonna review this again. Okay, but when we study cranial nerves, we also talk about this.
For now, is it okay if we just know extraocular muscles?
Well, when you come to the first committee, already all the lectures will be finished, right? So it doesn't matter, you know it right now or later on.
Okay.
But just I'm trying to make a effect in your brain, so you have heard this, okay? And you will. I think you're recording, right?
Yes.
Okay, so you can have that video and just listen and listen and listen and listen, right? How many times? In average, 7 times, okay? Average, 7 times. You can go to 15, 20 times. I do not object to it. That's fine. But at least 7 times. For you, maybe 5 times could be enough. Why are you laughing?
I'll put this on repeat.
Huh?
I'll put this on repeat while I'm listening.
Okay. So I did my PhD in the USA. I used to have a great teacher, anatomy teacher. He used to tell us always, you teach and learn anatomy by repetitions, right?
Yes.
Yeah, that's how you can teach your neuron to learn and to know how to use the knowledge to solve the problems. Okay? During the exam, during your career. Okay? So, repeat and repeat. Okay, right here you have the oculomotor nerve. Then, back here, this is your trochlear nerve, fourth cranial nerve. And then come back here. Right here you have the trigeminal nerve. This is the abducens nerve. Here is the facial nerve. On this model, we don't have intermediate nerve. This is the vestibulocochlear nerve. Then this is the glossopharyngeal nerve. This is the vagus. Here is the accessory nerve. This is the hypoglossal nerve. We covered this one as well. And then look at this one here. Here is your first cranial nerve. Here is the olfactory bulb. Here is the olfactory tract. This is the olfactory tract. Okay. I opened this one, but you never open this one, okay? I just can open this one. You never open it.
We have proof that you opened.
Okay, yeah, that's right. I mean, but you don't open because you have delicate nerves here. You can injure them. I will do my best not to injure them. But look at here, because after you, many students are going to use this one. You can destroy this one in 2 minutes, in 1 minute, right? We don't want it. Look at here, that's why this is under protection like this.
Can I ask a question before you start? Is this what abducens nerve controls?
That's very correct, yes. This is lateral rectus muscle, innervated by the abducens, abducts the eyeball, just like, okay. Now look at here, we can review most of the nerves here. Here you can see the olfactory nerve. Here is the olfactory nerve, olfactory tract. This is the optic nerve. Look at, this is the optic nerve. Look at, this is the optic nerve. Optic nerve enters the medial cranial fossa through passing the optic canal. Here is the optic chiasm, shown with 28 here. Right here, 26 is the olfactory bulb. 27 is the olfactory tract. But I never go with the numbers when I do the exam. So don't worry about the numbers. And do not try to study with the numbers. Study with the structure. Okay, I am not going, when I ask this one, I close the numbers. Okay? And honestly, let me tell you, numbering are wrong sometimes. Numberings are wrong sometimes. Okay. Now, let's move on. And then look at this one right here. So here is this is the
Dorsum sella? It looks like dorsum sella.
or trochlear nerve. This is the trochlear nerve. The trochlear nerve is here. So this is the.
Is it not the bone?
Oh, I'm sorry. This is the oculomotor nerve, not the. Here is the optic nerve, second nerve. Right this is the oculomotor nerve. Oculomotor nerve. And what happened? This is the trigeminal nerve, a huge nerve, right? This is trigeminal nerve. But here you have the oculomotor nerve, here you have the trochlear nerve, and then here you have the abducens nerve. And this is the trigeminal nerve. Trigeminal nerve is called trigemini. What is trigeminal? Triplets. Yes. Look at here. This is the ophthalmic nerve. You see? Ophthalmic nerve. This is the maxillary nerve, leaving the cranial cavity through the foramen rotundum. And this is the mandibular nerve, leaving the cranial cavity through the foramen ovale. Foramen ovale. And then, right here, look at here, internal acoustic meatus. You have facial nerve and vestibulocochlear nerve right here. Look at this is the facial nerve. Facial nerve entering into the facial canal, and leaves the skull through the stylomastoid foramen. Stylomastoid. Let me take you see somebody injured this one. Let me try to operate this one a little bit. Okay, look at this one now. We fixed it. Operation is successful. You see this one? So this is the facial nerve inside the facial canal. You see, this is a nice one. So the facial nerve leaves the cranial canal, cranial cavity through passing the internal acoustic meatus, but does not leave the skull. Enters the facial canal. You see, this is the facial canal. Leaves the facial canal through the stylomastoid foramen. Okay, good. And we have also here vestibulocochlear nerve, but it's not really shown here, vestibulocochlear nerve. And then look at here, this is the jugular foramen. Through the jugular foramen, 3 nerves leave the cranial cavity. One is look at, you can see it here, this one. This one is the glossopharyngeal nerve. Can you see? Glossopharyngeal nerve. This is look at vagus. In the middle, the large one is the vagus. It's okay. And then you have this one here. They are very much
Accessory.
depending on your video.
Accessory.
You see, they are not listening to me. They are not looking at me. They are purely relying on your video. Make sure it is successful.
I will sell it.
Yes, I think so. I think you should do that. You're right. Because
Earn a pocket money. Buy food for your cat.
she's putting a lot of effort to get a good video for you.
Hocam, next week I'm gonna bring a tripod.
It's okay. Okay, so this is the spine accessory nerve. So the 9, 10, and 11th cranial nerves leave the cranial cavity to the jugular foramen. Jugular foramen. Okay.
Is this the internal carotid artery?
Look at this is the right there. This is the vagus. Running down. This is the vagus.
Okay.
This is the common carotid artery. Common carotid artery. Common carotid artery. This is external carotid artery. This is internal carotid artery.
Can you show where it reaches with the optic chiasm?
Optic chiasm.
Does it show?
Well, right here you have the optic chiasm. Look at this one. Is the optic chiasm here, right here.
Is this the...
That's the, this is the internal carotid artery. You see, going up on the lateral side of the optic chiasm. This is the internal carotid artery. You see? Internal carotid artery is this one here. Internal carotid artery. And then, this is the hypophyseal fossa, right here. So here you have the pituitary gland. You see how close association you have between the optic chiasm and the pituitary gland. Pituitary, just anterior to the pituitary gland, you have the optic chiasm here. Okay, and then what else we have here? Well, we're gonna cover this nerves later on and again and again. This is the hypocallosal nerve. Look at this is the hypocallosal nerve. Right here, this right here, this is the glossopharyngeal nerve. Let me give you a trick here. Hypoglossal nerve crosses external carotid artery laterally. You see this one? So the hypoglossal nerve crosses external carotid artery laterally. But look at this one. Glossopharyngeal nerve runs between the external carotid and internal carotid arteries. In other words, glossopharyngeal nerve crosses external carotid artery medially, internal carotid artery laterally. You see, if you look at the picture here, a definition is not going to confuse you, become confusing to you. But if you do not, look at this is the right here, this nerve here. This is the glossopharyngeal nerve crossing external carotid medially, internal carotid laterally. In other words, between the external and internal carotid artery. Okay. Again, this is the common carotid. What does carotid mean?
Unconscious.
Unconscious. Very good. Unconscious.
If you
Press both of your carotid arteries, you collapse and lose your consciousness. Okay? That's why you never get pulsation from the both carotid arteries at the same time. Use one side always.
Okay.
If you try to get pulsation from the both sides, you collapse your patient is going to fall down.
Okay.
And his or her relatives probably are going to give you very hard time, right? Okay. So this is the superior thyroid artery. Superior thyroid artery, first branch of the external carotid. Superior thyroid artery has a superior laryngeal artery going to the larynx. You see that? Very good one, this is. Superior thyroid artery going to the thyroid gland. But has a branch called the superior laryngeal artery, supplying to the larynx. And then up here, there is the lingual artery. Look at this one. This is the lingual artery supplying to the tongue. And then we have the facial artery. This is the facial artery supplying to the face. Facial artery. I can see the facial artery. And then this external carotid artery has also occipital artery, posterior auricular artery, also ascending pharyngeal artery. So the external carotid artery has 6 branches with 2 terminal branches. Out of 6 branches, 3 arises from its anterior aspect, 3 arises from its posterior aspect. The ones arising from its anterior aspect are superior thyroid artery, lingual artery, and the facial artery. The ones arising from the posterior aspect of the external carotid artery, ascending pharyngeal artery, occipital artery, and posterior auricular artery. And external carotid artery has 2 terminal branches. One of them is this one. Look at this one here. This is the superficial temporal artery. You can get the pulsation of this artery just in front of your internal acoustic meatus right here. It's easy to get its pulsation. Another branch is the thicker branch, is the maxillary artery. This one. Maxillary artery has several branches. We talked about that last year. You had better review that because we're gonna talk about this again this year. Middle meningeal artery, superior alveolar artery, inferior alveolar artery, infraorbital artery, sphenopalatine artery, descending palatine artery are all branches of the maxillary artery. Okay? Do you have questions? You don't have questions. You want to review this this pictures here? Which nerves industrial here?
Olfactory.
Olfactory, very good. Which nerve industrial here? Optic nerve. Which nerves industrial here? Leaves the cranial cavity. 3 and 4. 5, 1. And 6. Good, very good. Foramen rotundum. 5, 2. 5, 3. Mandibular. Through here. 7, 8. Through here.
9, 10,
11. And foramen magnum.
Actually, 11 as well.
Very good.
Accessory to, yeah.
Spinal part of the
spinal
accessory nerve. It's not spinal accessory, it is spinal accessory nerve.
Okay.
Accessory nerve has a spinal part
Cranial
and
part.
cranial part. Very good. And let's move on. And foramen secum, foramen lacerum, canalis carotid. Canalis caroticus, through which internal carotid artery enters the cranial cavity. Okay? And right here right here you have the optic chiasm. And imagine internal carotid artery coming up through here. So on the lateral sides of the optic chiasm, you have the internal carotid artery. Let's move on. From the inferior view of the skull, you see stylomastoid foramen, through which facial nerve exits the skull. Oval foramen, through which mandibular nerve leaves the cranial cavity. Spinous foramen, middle meningeal artery enters the cranial cavity, very good. Foramen lacerum means foramen of lacerations, no major structure passes through it. And here is the greater palatine foramen, lesser palatine foramen A, through which lesser palatine artery, nerve, and vein pass through the greater palatine foramen, greater palatine artery, nerve, and vein pass through. And this carotid canal has an entrance to it. It's called external aperture to carotid canal. There's an internal aperture to the carotid canal. Okay, let's look at this one. Remember this one, we're gonna use that's the supraorbital foramen, superior orbital fissure, and inferior orbital fissure. This is the infraorbital foramen. Just remember that. We're gonna use them later on when we talk about the branches of the cranial nerves. We talked about this last year. I'm not going to talk about again this here. And that's it. Do you have questions?
No.
Okay. What is the time?
3:54.
Huh? Let me get your, well, let's go out and get your attendance.